The ongoing Allina nurses strike is now expected to be the longest nurses strike in state history. More than 4,000 nurses from 5 metro area hospitals have been on strike for a month now. After rejecting the latest offer from Allina Health late last night, the union will have to bring another proposal to the table. The nurses union and Allina both talked to Nina Moini about what it will take to end the strike.
Signs of a standstill.
We gave as much as we could, and they kept wanting to take more back from us, and it wasn't a fair compensation for us.
Minnesota Nurses Association member Angela Becchetti is one of thousands of nurses who have been out of work for a month, picketing outside Abbott Northwestern, looking for spare work when they can.
The Ryder Cup was a big common one for nurses. The Uber is a big common one.
As of the start of this month, the nurses union was on strike for so long that members also lost their insurance, many relying on COBRA and MNsure until a compromise can be reached.
This is worth it, right? You know, we're making history in that we need Allina to address our concerns.
The concerns for the past several months have been over safety, staffing, and holding on to a health insurance plan with higher premiums but lower deductibles. Allina wants the nurses to switch to the same plan other Allina employees already use, saying it's more sustainable, although it would include higher deductibles.
This was a really fair offer. It provided for a wage increase, additional bonuses, really all of the safety and security provisions that they were looking for, as well as a smooth transition to a sustainable health insurance plan for the future.
Allina reported 25 more nurses crossed the picket line after the latest attempt at bargaining fell apart, for a total of 620.
It's the same proposal.
Becchetti says the latest proposal from Allina wasn't that different from a month ago when the strike began. She says thousands of nurses still on strike are holding strong.
Allina says it will keep its current 1,500 replacement nurses with no plans right now to add any more. Although Allina hasn't released the cost of the strike to them so far, they paid $20 million earlier this summer for another nurses strike that lasted just a week. This one is going into week 5 with no set date for another round of negotiations yet, Amelia.
And can Allina rather give the nurses a final take it or leave it offer?
They can, but they say they have no interest in doing that right now. Both sides say they really want to come to a resolution, so hopefully that can actually happen soon.
All right. Thank you, Nina.